Hello and welcome to Visual Pathology Lab. We are going to discuss a very important aspect of cell death, which is known as necrosis. Necrosis is basically the result of the proteolytic digestion of the cell and its contents. So whenever there is a release of certain enzymes like proteases, endonucleases, as a result of cell injury or as a result of continuous cell injury, then it leads to cell death. So what happens in cell death when we talk about the morphology of it, in necrosis, there are different categories depending on the type of organ it is affecting. So we will try to cover all those types of necrosis with a few pictures of for each category. So the first one that I'm going to discuss is coagulative necrosis. And the coagulative necrosis is seen where the organ is solid and it is not soft or rubbery. So in that case, when necrosis affects or the enzymes leakage that results because of the cell injury, or there is leakage of the proteolytic enzymes and there are eventually leakage of lysosomal enzymes when the lysosome ruptures and the membrane ruptures. So all of it makes up a lethal combination that causes digestion of the intracellular component. In coagulative necrosis, basically what happens is that the architecture of the cell remains intact, but the internal environment of the cell goes into infarction because of the loss of blood supply or ischemia. So you're seeing a spleen, which is a solid organ. So when necrosis occurs in the spleen, you can see these white areas. All right, and then you can see this white area. This is basically representing coagulative necrosis. Another very common example is the presence of necrotic area or infarcted area within a kidney. And you can see this is a kidney sample where there is a whitish yellowish area which is representing infarction or necrosis. So when you try to see this necrosis under the microscope, there is loss of the cellular content. Similarly, in the nucleus, there is endonucleases cause destruction of the nuclear content. So there is more of the eosinophilia, that is more of the pinkish color on microscopic. So when you compare normal tubule of the kidney with the tubule which is having this, you see this infarcted area. Why am I saying the infarcted area? Because when you compare it with this one, you can see that there are cells with a sort of normal architecture with cytoplasm and intact nucleus, but when you observe here, you will see fading of the nuclei. Cytoplasm will take up more pinkish color and the nuclei become fade, they become pycnotic, like they become shrunk, dot-like structures, and maybe sometimes the nucleus get a very dark color. So you can appreciate the fading of the nuclei here and a lots of eosinophilia in the cytoplasm. I'll give you so these are some of the patches of necrotic tubules that you can appreciate in the kidney architecture. Again, this is a coagulative type of necrosis because you can see that the architecture, overall architecture, is preserved. Going to the image, the kidney injury, you can see that there is eosinophilia, there is maybe fading of nuclei here, right? But you can also appreciate that there is vacuolar degeneration. What is vacuolar degeneration? The whitish area, the tissue become vacuolated. So this is one another sign of necrotic tissue. Another example could be of a lung. Lung is most of the time present having necrotic tissue in the form of vacuolar degeneration, which in the hepatic area is known as ballooning degeneration. So what happens is that they become large. This is a normal hepatocyte, and when you compare it with this one, see, you can appreciate that this become large in size, it has more eosinophilic cytoplasm, and there's faded nucleus. And on the other hand, you can see these balloon shaped bigger cells, which are actually nothing but the hepatocyte, which has undergone ballooning degeneration. So this is a type of morphology that you come across in the case of liver infarction. This is another example of ballooning degeneration. And these are the pigments that have been accumulated. These are nothing but the bile, right? Okay, coming to the myocardial necrosis, which is the prime example of coagulative necrosis, and is evident in this picture. Like, let me give an example. You can see the normal architecture or normal stain of the nucleus, striated fibers seen in the myocardium, but when you compare it with this fading nucleus, more eosinophilic cytoplasm, at places you will only find cytoplasm and no nucleus. So this is basically how myocardial infarction presents. So I'll give another example of myocardial infarction, and it is more severe because at first you cannot recognize the tissue. But if I suggest you that this is myocardium, then you will notice nothing but these tiny pyknotic nuclei in the substance of this myocardial tissue, which has undergone a severe necrosis, extensive necrosis, I would say. So these dirty appearance of the tissue is because of there's degradation of the cytoplasmic content. There is pyknotic and karyoresis also occurring at certain places. There is no nucleus, it has been faded already. So this is how a coagulative necrosis looks upon that. For other type of necrosis, please watch my next video. Thank you.